Thinking about the state that we live in, we are all spread out. So what is available in Missoula is not available in Havre. And also too, the communities are different. What we experience here in Missoula is absolutely not the same as in Browning or the Crow Agency. So it's helpful that a community health worker has been in that area for a while and understands what's going on in the community and has an extra level of experience and understanding of that particular community. My name is Jobina McCarthy. I've been in Missoula for over 20 years. I am a community health worker in the form of a family navigator at the Rural Institute for Inclusive Communities at the University of Montana. I work under Montana Family to Family. So we provide resources and education to other moms, dads, caregivers who have kiddos with special health care needs and behavioral health care challenges. A community health worker is somebody that usually has direct experience navigating, whether it's a system of healthcare or accessing social services. It's someone who has probably accessed those systems and learned in detail how to make it work. The work that I do is because of the lived experience. I've had two children. My first was a preemie. He was born too early back in the 90s. We didn't have the technology to save preemies at that age. So Tyler is an angel in heaven. And then I have a 17-year-old who is also a preemie. Quinn was born 2.5 months early. And so I navigated that with Quinn being in the NICU for 2.5 months and going through the surgeries and raising a immune compromised child. And so learned firsthand how to navigate that world. So a community health worker is a bridge between somebody that needs the services and the services. Those don't always meet.
I was actually one of the first community health workers. I worked in Missoula by myself for a solid year before there was other community health workers and programs available. And so I just took it upon myself because nobody knew what we were doing. It was a brand new program and no one really heard of it. I was in housing before and worked with the domestic violence survivors. And I just went out actually to the Poverello across the river and asked them, if there's any people that need some extra help that is not connected with anybody. And so a lot of them were the Native American population and the elderly. And so I took it just upon myself to specifically work with people that nobody else can connect with in the community. And that is like everybody that had a dual diagnosis. They just couldn't form relationships with them. And so I would find them wherever they were camped out and just go out and meet with them and talk to them and bring them like sack lunches and water and clean socks and just access, just tell them a little bit about the program and if they needed any services. And so I've helped quite a few people, like the elderly, get housed. Unfortunately, they don't really ask for help. Some do, but then there's so many people that need help, they kind of slip through the cracks. And so, that's what drew me to community health workers, is because I've been homeless. I've been, have a substance use disorder, had mental health disorders. And I've been there, in crisis with my children, struggling to pay rent and not having enough money and having to decide, well, should I pay rent or should I pay my lights, and being a single mom and not having, like, I had a felony, so I was denied access for my voucher. It was a struggle, and it was a daily struggle. Like, I'm glad for the food stamps, because without food stamps, I would have never been able to provide food for my children. I have 6 children, being a single mom, it's pretty hard. And working, not having an education, then I didn't go to school or college until I was 35, and that was after I got out of prison, and that was like a wake-up call. It was like the most embarrassing time of my entire life, ever being in prison and being away from my children. And then when I got out, it's just how everybody like looked at me, and they viewed me like, oh, she's just, she's been to prison, and we don't know if we want her in our properties. And so when I got out of prison, I actually lived in the shelter in Butte for like 6 weeks until I saved up some paychecks and got into my own place.
The folks in Montana who have lived here all their lives, are having trouble just affording housing without working 2, 3, and 7 jobs in order to afford it. And so, as a community health worker, in that immediate need, doing what we can to help our local folks right now, with whether it's applying for housing assistance, whether it's the Resource Council or through the state, but then also too working with the folks at the state, the city, the county, and the state level, and helping them understand what our folks are dealing with and how we can help elevate their voice into what they're going through, and see if we can make some change and some help.
I met Tim about not quite a year ago. Tim, at that time, where were you at?
Living in a camp trailer, a small camp trailer in my niece's backyard. Had all kinds of agencies and stuff to deal with. After having COVID, I have a hard time now of understanding what they want on all of the paperwork.
Yeah.
It's rather difficult and intimidating, because they want things done on the internet, and I don't do the internet at all. So it's another strike against me. And where she come in was really helpful, because I just couldn't do it.
Well, and those forms are not easy. All the housing forms are very complicated, and just the whole system in general is complicated. So unless you know where you need to go and how to navigate that, it's intimidating for anybody. I think when we first met, you were kind of thinking about finding housing, but you're also thinking about maybe needing a little more support in what you get at an assisted living facility.
Physically, I can't take care of myself either. I can't do the cleaning. I can't. By the time I cook a meal, prepare it and cook a meal, I'm so tightened up and everything. I've got to wait half hour to be able to eat. So it's like it's very difficult. Um, I ended up losing weight. I got down to 117 pounds, and now I'm 142. They got me back up. They're getting me fattened up. So
Yeah, and you look really good.
a lot better than what I was.
Yeah.
It's been a good 7 months.
Mm-hmm.
There's they've got activities and stuff, and they do stuff for the holidays. And I'm not used to that, but they're softening me up.
I'm Jane Emmert. I'm the director of the Assist Flathead program here in Kalispell, affiliated with Logan Health Medical Center. And we are a nonprofit that helps people connect to community resources. And because the social service system is pretty complex, some people can't navigate it by themselves. And our role at Assist is to make a difference, to help people succeed by connecting them to community resources that help them regain their health and independence. And so at this table, we have what I would call a fierce group of advocates who are in care coordination. And they help to be tenacious bulldogs to help people as if they were their own mother, father, brother, sister. How do I help them get the care they need? And so we have a diverse group, some who are in care coordination inpatient, outpatient, and then the Assist Neighbors Helping Neighbors team. I want the community to realize that we don't have a very big team. We have 2 community health workers. We have 15 volunteers who come alongside the community health workers and make the home visits. And yet we can have a significant impact even without a ton of expense. Our value, the value of what we provide the hospital, even with basic calculations, because it's hard to quantify the value of social determinants of health. I can quantify what it is to get somebody on medical care or get them housing or assisted living or skilled nursing facility and food. Those are about the only things I can quantify. Do you quantify helping them get teeth? Do you quantify, helping the family navigate paperwork to get someone into a long-term care nursing? That's hard to quantify. But our value to the organization is over $1 million a year. And that is impressive to me, but more important, it's looking in the eyes of the people we help. Because to them, what we do is priceless.
Here at Lyft, we cover the southeastern, eastern 18 counties in the state of Montana. We have 6 core services that we run for the independent living side. Those 6 core services are anything from peer support. We do a lot of peer support, help people out just by talking to them primarily. We do advocacy. If people have an issue and they need someone to help them express what's going on, we do that. And keep in mind this for people with disabilities. Oh yeah, and speaking of that, disabilities, it could be any disability. Other services we provide, personal care assistant, PCA. So if you have a mother, grandfather, grandpa, anybody, child, whatever the case is, they cannot clean for themselves, cannot cook for themselves, cannot shop for themselves, we can help them. We have a community health worker program that I'm the supervisor for. Here in the Billings area, well, technically, I'm the only one. We need more CHWs. Community health workers, for what we have the capability of doing and the services that we provide, most of them are underpaid. I know a community health worker gets paid $13 an hour. For the services that we provide, that eventually saves the insurances so much money because we're there doing what we do, they'd be crazy not to give those folks pay raise. But the problem is, though, once again, keep in mind, it takes a special type of person to go into like somebody's house who's like, and they're severely disabled. Yep. You have to be and have a certain mindset to be able to do it. And unfortunately, we just don't have enough bodies. And unfortunately, until they figure out the pay portion of it, it's not going to happen. But luckily, we've got the folks that we have. We're lucky. I'm hoping that we could develop a more defined task and purpose for the community health workers. But once again, though, community health workers is not their primary job.
So we're gaining ground, and partners are realizing the value that we provide. And but still where we are is, we have to find grants in order to fund our work, and the need is so high, it's just not enough. So what we will ask the state to do by forming the Community Health Worker Coalition is, in this next year, we will be going through and creating a code of ethics, training standards and such, so that we will be a cohesive profession. But we want to make sure that the training is cohesive, that we are all, for instance, certified and trained in CPR. Culturally, we understand that there's not just one culture in this state, that we all know that we understand other cultures, that we are sensitive to it. We want to be recognized as a profession through the state, and we will have continuing education going on, and that we would like that to be recognized. And further, we would also like to be reimbursed by Medicaid or other state programs, so that it is sustainable, so that we can do this long term.
My name is Jace Dykeman. I've been at Riverstone Health for probably about 14 years. So I'm under the public health umbrella. I'm actually a patient. I've been a patient here for, 40 years. How old am I? I'm 61. Holy cow. So like 40 years I've been a patient here, so I'm really familiar with the organization. In fact, back when I first started coming here in the 80s, it was just a one-room clinic, and it was the STD clinic. It was Deering Clinic. So we've seen a lot of growth. I was a meth dealer here for 20 years, so I actually know our population pretty good. So I understand people's journeys and at times when they're ready, when are they ready. And they may not ever be ready, but that's okay. We're trying to get them where they're at. I was also diagnosed with AIDS 30-some years ago through this clinic. So I have understanding of our population living with HIV and our drug-using crowd, and that's, I think, why this is a great fit for me, because I understand how those two correlate with HIV prevention. So our goal is to try to make sure there's resources out in our community and make sure people that are newly diagnosed have access to care, which we do have a Ryan White care clinic at our clinic. We try to meet people that are high-risk populations, men who have sex with men, people who inject drugs, sex workers, people who have multiple partners, make sure they have the tools they need for HIV prevention. Part of our goal is we do hand out some syringes, but we also have safe injecting kits, so they're having clean syringes for safe injecting, so they're not getting abscesses, other wounds going on, not spreading HIV, Hep C. We have condoms and lubes or safe sex. We try to educate on that. You have to understand that people are in active drug use. They're on a journey, and that journey is different for everybody. There's always going to come that point when they feel in their heart that they need help now. We want to make sure we're there, because if we miss that point, it may be 2 or 3 years till they get to that point again, or they may end up in jail or dead. So we want to make sure we're available when they hit that point of where they're ready, make sure they have the resources they need. We're like there to take care of the whole person, make sure they have what they need for today, because sometimes that's all they're looking for is today.
Sometimes they're looking for housing, sometimes they're looking for food. We have a lot of stuff that's donated here. Here and there, people will donate some clothes or toilet paper even. I mean, it's just the little things that a lot of people take for granted in their everyday lives that these people don't have access to. So what I love about doing this kind of work is that, it's helping to destigmatize addiction, first of all, because people are able to trust that they're not going to be judged, and I get to connect with them on a different level. I've been doing this kind of work for about 8 years. I just got to Riverstone in January, but I love to connect with the clients. They come in here and there are all sorts of other health issues that they could be dealing with that maybe they haven't been to a doctor for, or they need help finding a resource in the community. And so it gives me an opportunity to ask them some questions and build rapport and trust with them, and then they tell me things that are going on in their lives that they wouldn't normally tell other people. I have been in recovery for going on 15 years, and so I have been where some of these people are, it's in my family, and And so, I have a different way of connecting with them, and there are certain language and things that you say or you don't say in conversations with people in that state of being. And so I think, one thing I do want to add that's personal to me is that I lost a family member a couple years ago to fentanyl poisoning, accidental. And so I'm really passionate about getting information out to this community on their level, because it's one thing for people in the healthcare field to know about what's going on in the community as far as like fentanyl and opiates. And the risk of overdose and fatal overdoses. And it's another thing to dispel a lot of myths that are going on within that community, and to actually hand them the tools that they need, and they're going to bring it back to the places where people use. And so I really love that about this program too, is it's not just about giving them the clean syringes, it's also about educating and helping to keep people alive. So there is a lot of judgment around addiction, and especially people who are injecting. So many other things attached to that, homelessness, even crimes and things like that. And I would just say that, I look at everyone who walks through the door here as a human being, as somebody's son or daughter. And so when I think of it that way, I just want to be the best that I can be in, in that moment for them. So.
It's just exciting to see people that have been struggling for so long receive a little bit of stability, and that's the big reward right there, is just having people have stability.
My outlook was pretty bleak, and I just didn't know where to go and how to get things done.
Mm-hmm.
It was a real good thing I got in touch with the office, and they put us together, and it's been pretty good.
We have a rugged mountain man mentality in Montana, and a lot of our folks, like the man surviving on $600 a month, he's figured out how to survive. But it doesn't have to be that hard. And so trying to get him the services he deserves is really important.
I love the idea of a rising tide lifts all ships. And, we all live in the same community. So if more of our community is healthy and can fulfill their dreams and whatever they would like to do, then we all work better. We all are healthier. We can all do good things. So it's not just this individual, it's all about me, but truly we're all in this together.